Now that he's retired, Doug Rushton is enjoying taking it easy. But at 69, he's also taking extra steps to make sure he doesn't get sick this flu season.
Well, your system is not as well prepared to fight it off as one, say, your age is.
Rushton says he falls into the geezer category. His words, not mine. And he found a recommendation by the National Advisory Committee on Immunization that anyone over 65 could benefit from a high-dose flu shot called Fluzone, which causes more antibodies to be developed to fight the virus.
So I went looking for it.
But every pharmacy Rushton called told him the same thing. They don't carry it. CBC News reached out to a dozen pharmacies across the Lower Mainland, and none of them carried any Fluzone. Most weren't even sure when any would come in. But a spokesperson for Shoppers Drug Mart did say that they expect a shipment to come in by the beginning of December, smack dab in the middle of flu season.
That'll be too late for anyone who was anxious to get a flu shot in the first place.
The vaccine isn't covered by provincial health care in BC, unlike other flu shots. The company that makes the vaccine sent this statement to the CBC. We prioritize the delivery of these vaccines for all provinces and territories that have public programs each year. Those are Ontario, Manitoba, Saskatchewan, Northwest Territories, Nova Scotia, and Prince Edward Island. The company supplies only limited doses of the vaccine to BC, and anyone who wants it has to pay $75 a shot. In a report based on findings by the Advisory Committee, the BC Centre for Disease Control explained why the province doesn't cover the cost. The evidence and anticipated incremental benefit of a high dose is not commensurate with the additional five-fold cost. Basically, it's too expensive and there's not enough proof that it's worth it. BC's health minister says the province is simply following the advice of the same advisory committee that says Fluzone is helpful for seniors.
Well, the National Advisory Committee on Immunization is not recommending coverage under public health plans. We follow the experts in terms of immunization policy.
But Rushton doesn't buy that explanation.
If it's okay or a good idea for all those people, why isn't it a good idea for British Columbians?
For now, he's left choosing between getting a regular shot or risking a bout of the flu while waiting for the high dose to arrive in pharmacies. Joel Ballard, CBC News, Vancouver.